Infant colic, how to help your baby make air. In this video, I explain how to tell if your newborn has air in his belly, how to prevent your newborn from sucking in too much air when being fed, and how to help your baby make air. Most importantly, I explain what are the real causes of infant gas colic and how to treat them effectively. Before we continue, let me introduce myself. My name is Dr-Silva. I am a neonatal osteopath and founder of Yule, a maternal infant center in the province of Monza and Brianza, in which I collaborate closely with leading health professionals in the field, such as pediatricians and midwives, visiting only newborns from their first days of life. You can find me online at this YouTube channel, which I recommend you subscribe to now to stay updated on all new videos. You can find me on Instagram under the name Osteopath Silva Matteo, and especially on my website matteosilvaosteopata.com, where you will find hundreds of informative content and video courses to encourage the best development of your baby from birth to independent walking. Now let's cut the nonsense and get to the heart of the topic of this video. Colic gas, what is it? Not knowing the true causes of infant colic, this issue used to be defined as a behavioral syndrome of the infant, characterized by crying and intestinal pain, during which attacks the baby to bellyache and may emit gas, then air or stool. To date, scientific studies show that colic is not caused by intestinal immaturity. Because let's face it, can an immature intestine give pain? Infant gas colic is caused by an inflammatory bowel framework. That's why the baby has a swollen, strained, air-filled belly, but more importantly, that's why the infant has a bellyache and cries. This is proven, without a shadow of a doubt, by a recent scientific study of 2018 that I link to you in description, and which is called Infantile Colic: New Insights into an Old Problem, published in the journal Gastroenterology Clinics of North America. How to tell if the infant has air in the belly. In light of what has been learned, to tell if the infant has air in the belly, one must first palpate the baby's abdomen to see how tight it is. When the infant suffers from colic, the abdomen feels hard and not very palpable. In these cases, it probably has an inflammatory picture and as a result, also air in the belly. Another way to tell if the infant has air in the belly is to obviously listen for bowel noises and any gas emissions, thus air. Very often an infant suffering from gas colic will cries until he or she emits air. Offices. But how to prevent the infant from sucking air? It is often thought that one of the factors responsible for gas colic is swallowing air while the baby sucks at the breast or bottle. But is this really the case? How to prevent the infant from possibly sucking air? In part, the answer is already in the explanation of what gaseous colic is. Gas colic is caused by an inflammatory bowel pattern. So it is inflammation that creates pain and air in the belly. Gas colic is not caused by the air that the infant sucks in when breastfed. However, it is important to say that ensuring effective suction during breast and bottle feeding is important anyway to prevent the infant from swallowing a little bit of air. Let me explain further. When the suction of the perhaps breastfed infant is too rapid, the baby sucks in a few tiny bits of air and is more likely to swallow more easily. This can give some discomfort to the infant, make it easier perhaps for the baby to burp, and make the first digestion a little bit more difficult. The same is true when the infant is artificially breastfed. If the infant drinks too fast, he sucks air, he is in danger of gorging himself. Again, the more easily the infant needs to put then burp to put in air. And his digestion may start a little bit worse. However, it is crucial to emphasize that sucking air is not the main cause of colic or even the solution to it. Colic is caused by various factors, and in the video course Prevention and Treatment of Infant Gas Colic, featured on my website www.matteosilvaosteopata.com, I explain exactly what they are and how you as a parent yourself can solve them. How, however, can you help your newborn baby make air from his or her belly? A first exercise to improve dyschezia, stips and colic is to flex the infant's legs toward the belly. In this way, we slightly increase abdominal pressure and promote the expulsion of air and stool from the belly. In addition, by flexing the legs, we facilitate the stretching of the pelvic floor and the emission of air and poop. I recommend that you do these movements and massages when your baby is quiet, not when she has a tummy ache. A second movement you can do to help your newborn make air from his or her belly, obviously improving constipation but also generally improving transit, is certainly the sun moon infant massage. This massage consists of gentle pressure on the infant's belly with movements that trace the stylized image of the sun, then in a circle, or the moon, then in a semicircle. The idea is to massage in a peristaltic sense the intestines to facilitate intestinal transit and help the infant eliminate air from the belly. The third way, as well as the most effective way to massage your baby's belly and improve abdominal bloating, dyschezia, stysia and colic, is belly osteomassage. Osteomassage is a sequence of osteopathic massages that I designed and teach every time to the parents of my little patients. These massages work deeply on the gastrointestinal system. They are very easy to do, and that is why they are so effective. You can find them in the video course Cure and Prevention of Gassy Colic. Before I conclude, I want to remind you that these massages are to be done along with all the precautions that I explain in the course Care and Prevention of Gaseous Colic. Otherwise, you will not get the desired results. With these last sentences, this video has come to an end. It has been a pleasure to create this informative content for you, and I sincerely hope that it can be of great help for your beautiful baby. If you enjoyed this video, I kindly ask you to leave a like. It costs you nothing, but it is really worth a lot to me. To subscribe to my YouTube channel, to follow me on my Instagram profile Osteopath Silva Matteo, and to visit me on the website matteosilvasteopata.com. See you in the next video.